President Trump signed an executive order today giving pharmaceutical companies 30 days to lower prescription drug prices. Otherwise, he says he will reduce what the federal government pays them for drugs through Medicare and Medicaid.
At the same time, Medicaid, which provides health insurance for low-income Americans, could be a target of Trump budget cuts. Critics say that is a prescription for disaster. Here's Nicole Killian.
I've been dealing with most of this, my whole life.
24-year-old Yoli De Leon Beltran has been coping with chronic health issues affecting her joints and nervous system since she was a child, which requires a lot of medication.
Overall, it's about 30.
30 medications?
Yes.
That's a lot.
Yes. Yes.
How do you pay for all of this?
I am very fortunate that I have Medicaid. They have been paying 100% for most of my medications.
But she worries her coverage could be impacted as House Republicans finalize portions of President Trump's legislative package, seeking at least $880 billion in savings that could include Medicaid. Valley Health CEO Mark Nance runs 6 rural hospitals in Virginia and West Virginia and has lobbied lawmakers several times this year.
We need a solution that's workable. And throwing out a number like $880 billion, I mean, somebody's going to get hurt in that situation.
GOP lawmakers argue the latest proposal would strengthen Medicaid and eliminate waste and abuse. While it backs off deeper cuts, it would require recipients work, volunteer, or attend school up to 80 hours per month. The Congressional Budget Office says at least 8.6 million people could become uninsured if the bill becomes law.
Would you have to close your doors?
We'd have to think about, can we keep every location open? I don't think Valley Health would go out of business per se, but I think that Valley Health would look substantially different.
For Yoli, who visits Valley Health's main hospital about once a month, it's a lifeline.
What would you say to lawmakers?
There are people on this program that would not be alive right now if it weren't for this program.
The president is urging Republicans to unite behind this bill, which would use some of these cuts or savings to help pay for an extension of his 2017 tax cuts.
A debate in Washington could reshape health care for millions of vulnerable Americans. You might miss it, though, because the debate gets abstract. $880 billion in savings, a 7-vote GOP majority, Republican moderates and their political concerns. Beyond Washington, doctors and nurses in rural America talk specifics: 50, 40, 120. Those are the miles their patients must travel to get basic care. I've talked to providers from Rugby, North Dakota, to Carlsbad, New Mexico, to Robert, Louisiana. Distance means missed appointments, lost wages, no public transportation, fewer chances to monitor diabetes, fewer touch points to spot mental health concerns or ensure blood pressure meds are being taken. Peggy Guttrow delivers babies in southern Louisiana. Long drives, she says, mean skipped prenatal visits, which risk the health of the mother and the baby. According to the Congressional Budget Office, 8.6 million people could lose coverage as a result of Republican plans, many in rural America, where Medicaid isn't just a safety net, it's also the scaffolding that holds up rural hospitals, serving more than 66 million Americans. They're strained. Since January 2005, 194 rural hospital closures and conversions. In the dozen years before 2023, 1 in 4 rural hospitals stopped delivering babies. When coverage disappears, the medical need doesn't. It resurfaces in the emergency room, where it costs more. Republicans say their plan would trim waste, fraud, and abuse, and work and eligibility requirements would save money. Rural health providers are very skeptical and worry that the cuts will happen, the savings won't show, and fewer people will be covered. More hospitals will shutter. The drives will get longer, said Dr. Bruce Weber. You better be prepared to deliver a baby in your back seat. When I started reporting on how Medicaid cuts would affect rural health care, I didn't expect to hear about young men like Alex Jacobson. For Alex, Medicaid was a lifeline. His father, David, says it supported the rural Iowa hospital where Alex received mental health care. Usually, the conversation about gaps in rural areas focuses on young women. That's because so many rural hospitals have stopped helping young mothers. Between 2011 and 2023, 24% of the country's rural hospitals stopped providing obstetric services. But when I talked to midwife Peggy Gautreaux in Louisiana about those numbers, she raised another issue: the growing number of men showing up at her clinic for mental health treatment. When care is embedded in a local clinic, when patients don't have to drive hours or wait in a psychiatric emergency room, they're more likely to use it. That's especially true for men, Gautreaux said, who often face more stigma when seeking help. If you're sitting in our waiting room, nobody knows if you're here for a sore throat or because you couldn't get out of bed this morning, she said. So what happens when Medicaid cuts make those services harder to find? That's what worries Alex's father, David Jacobson. He's seen the system fail. One night, his son called him desperate for help. They waited for hours in the emergency room until a bed opened in Sioux City, more than an hour away. Protocol meant police had to take Alex there in handcuffs. At a recent town hall, Jacobson's Senator Joni Ernst of Iowa was asked about Medicaid trade-offs. A constituent warned that people will die if they lose coverage.
Well, we all are going to die.
Yes, we all die, says Jacobson, whose son Alex died by suicide 5 years ago. But it's not about dying, he says. It's about compassion. It's about helping the vulnerable while they're here.